Hello everyone, welcome to another episode of the NSS Heartbeat. My name is Philip, I'm a nurse by background. In this episode, we are reviewing NCLEX practice questions for heart failure. In my previous episode, we reviewed the content for heart failure, where we realized that we have left-sided heart failure and right-sided heart failure. The left-sided heart failure presents with LP, lumbar puncture, left pulmonary. So the left-sided heart failure, we are going to have pulmonary symptoms. And then the right-sided is right-sided RS, right systemic. So the right-sided heart failure is going to present with systemic problems of the body. So if you have not watched that video, you can have that on this channel to watch. So let's go in today for the questions, and it will help you to appreciate what we did on the previous content review of the heart failure. So I have 20 set of questions to review under heart failure and clear style questions. And the first question, without wasting time: a patient with left-sided heart failure reports difficulty breathing when lying flat. Which term describes this symptom? A. Paroxysmal nocturnal dyspnea. B. Autopnea. C. Dyspnea on exertion. D. Chine stroke respirations. And the answer is autopnea. So when you have heart failure and you are having problem lying flat, that is autopnea. Paroxysmal nocturnal dyspnea. Nocturnal is night. They are those that happens in the night. Dyspnea on exertion is when you are moving, and that is not all of that. And then the chine stroke is the zigzag one. It comes and it goes on and off. So this one is autopnea. Question number 2. A nurse is teaching a patient with heart failure about daily weight monitoring. Which statement indicates understanding? So what did we talk about when it comes to nursing management for heart failure? We talked about daily weight monitoring. So which one will indicate understanding of the patient? A. I should weigh myself once a week at different times of the day. B. I should weigh myself every morning after using the bathroom. C. I should weigh myself after meals. D. I should only weigh myself if I feel swollen. So the answer here is B. I should weigh myself every morning after using the bathroom. This is going to give you accurate reading. So early morning, so you have to weigh yourself at the same time every day. So every morning after you use the bathroom, you'll be able to get accurate reading. You don't weigh weekly, and you don't weigh only when you feel swollen. You should weigh yourself, and you don't weigh every day but at different times. That is going to give you inaccurate readings. So weigh yourself at the same time each day. Number 3, which finding indicates right-sided heart failure? So when you are tackling this question, we have discussed that right-sided is systemic, right-sided RS, right, with systemic functions. So systemic heart failure, it means that there is bad flow of blood into the system. The blood that's supposed to go into the lungs to go to the heart so that it can go into the lungs for oxygenation is coming back into the system. So we have jugular vein distension, ascites, edema. They are all associated with right-sided heart failure. So let's look at the options. 1, crackles in lungs. Lungs, pulmonary is left-sided. So anything that has to deal with pulmonary, we rule it out. Jugular venous distension. Autopnea, pink frothy sputum. So crackles in the lungs, autopnea, and pink frothy sputum, they are all issues when there is congestion in your lungs. So the best answer is jugular vein distension. That is the systemic. Your veins will become distended. Question 4. Which lab test is most indicative of heart failure exacerbation? A. Elevated creatinine. B. Low hemoglobin. C. Elevated BNP. D, high sodium. The answer is what? C, elevated BNP. We said BNP above 100 when it is raised indicates heart failure. Question 5. A patient with heart failure has gained 4 stones in 2 days. What is the priority action? A, reassure the patient this is normal. B, restrict sodium intake further. C, notify the healthcare provider. D, encourage more oral fluids. Now, gaining 4 stones in 2 days accumulation of fluid and it needs urgent attention. So the first thing you have to do is to notify the healthcare provider. That is option C. Which medication should the nurse caution for a patient with heart failure? Now, with heart failure, from the previous video, we talked about treating the heart failure with beta blockers, ACE inhibitors, and then diuretics, basically. So let's just rule out which one is not any of these, and we are gone. Lisinopril, furosemide, ibuprofen, metoprolol. So all the other 3, they fall within these classes I mentioned. So there is an odd one, ibuprofen. So we don't give ibuprofen in heart failures. And the reason is ibuprofen is an NSAID, non-steroidal anti-inflammatory drug. And these ones increase sodium accumulation in the blood, which will further increase retention of fluid in the body. And we don't want that. So we don't give NSAIDs like ibuprofen. Number 7. Which finding is most concerning for digoxin toxicity in a heart failure patient? So patient with having digoxin that has developed toxicity, which finding is concerning? A, heart rate 98 beats per minute. B, visual disturbances with yellow halos. C, mild ankle swelling. And then D, weight gain of 1 stone in 2 days. And the answer is B. So digoxin toxicity, one of the side effects is halo vision. So that is something should be concerning and you should report. Number 8. A nurse is caring for a patient in acute pulmonary edema. We've gone to the lungs. What is the first intervention? Pulmonary edema, there is lung congestion. So we want to position the patient first and foremost to make sure patient is sitting well so patient can breathe better. Then we will check oxygen requirements. If patient needs oxygen, we can give oxygen. And then pain and other treatment comes in. So position is very key. So let's look at the options. Administer IV fluids. Edema, IV fluids, you're going to complicate things. Place patient in high Fowler's position. Provide a high sodium diet. Apply compression stockings. So the answer is position, high Fowler's position. And we talked about positioning patients to semi to high Fowler's in heart failure to help them breathe well. We don't administer IV fluids. We don't provide high sodium diet. It will further cause accumulation. The edema will rather increase. And apply compression stockings. That is not our priority. Priority is to help patient to breathe. So position is very key here. Number 9. Which assessment is most reliable to monitor fluid balance in heart failure? A, blood pressure. B, daily weight. C, skin tegel. D, urine output. If you are monitoring fluid balance, which assessment is very key? Daily weight of the patient. So that is B. Number 10. A patient with heart failure is prescribed furosemide. Which lab value requires immediate attention? Now, we have said that when you are administering furosemide, that diuretic has the potential to reduce potassium. So we are observing for low potassium. The normal value of potassium is about 3.5 to 5.5. Okay. So anything below 3.5 is leading you to low potassium, side effect of low diuretic furosemide. So let's look at our options. A, potassium 2.9. That's low, sign of adverse effect. So it requires immediate attention. B, sodium 138. Calcium 9 milligram, magnesium 2.0. They are all not, sodium is fine, they are all fine, magnesium is okay. So potassium is the key. So I always say that when the question is presented to you, even without looking at the options, what are we looking at? Furosemide. Okay, so potassium is our key. Then you go with that focus and you will be able to get the answer. Number 11. Which sign indicates left-sided heart failure? Don't even look at the questions or the answers. Left-sided, LP, lumbar puncture. Left pulmonary. So left-sided, we are going to look at signs that are associated with the lungs, congestion in the lungs and all the lungs issues. So you have these tips, then you can tip them in the answers. Let's go. A, hepatosplenomegaly. B, ascites. C, crackles in lungs. D, peripheral edema. So crackles in lungs, that is pulmonary. All the rest, you can see that they are systemic symptoms, and that goes to right-sided. And even if you don't know this question, one of the tips of NCLEX is you can see that all the others are very similar. Hepatomegaly, hepatosplenomegaly, your liver and your spleen are going to enlarge. Ascites, body enlarge. Peripheral edema, the peripheries of the body will enlarge. So they are all systemic. You can see crackles in the lungs is the odd one. That will even give you an indication. Question 12. A patient asks why they must limit fluids with heart failure. What do you have to say? The nurse should explain. A, fluids can dilute your blood. B, fluid restriction helps prevent further fluid accumulation in your body. C, fluids cause high blood pressure. D, fluids decrease the effectiveness of your medications. Why should we restrict fluids? Fluid restriction helps prevent further fluid accumulation in your heart, in your body, sorry. And that is the perfect answer. So heart failure, there's accumulation of fluid in the body. So we don't want to compound that problem. So we restrict fluid in heart failure conditions. Question 13. A nurse is reinforcing teaching on low sodium diet for heart failure. Which food should the patient avoid? A, fresh apple. Is fresh apple high in sodium? That should be avoided. Canned soup, unsalted nuts, plain oatmeal. The answer is what? Canned soup. Canned foods have very high sodium content. 14. Which action should the nurse take when administering IV furosemide to a heart failure patient? A, infuse rapidly over 1 to 2 minutes. B, monitor for tinnitus. C, restrict potassium-rich foods. D, administer in the evening. Given furosemide, one of the side effects is tinnitus, ototoxicity. So that is what you should monitor. You wouldn't infuse furosemide rapidly over 1 to 2 minutes. No, it should be infused quite slowly. And then you wouldn't restrict potassium-rich foods because potassium depletes. Furosemide depletes potassium, so you rather encourage potassium-rich foods. and then administer in the evening. Diuretics, patient is going to pee quite a lot, so we wouldn't advise giving it even in the evening. Most of the time it's in the morning. Question 15. Which is a major risk factor for developing heart failure? Hypertension. Let's look at the options. Hyperthyroidism. B. Chronic hypertension. C. Hypokalemia. D. Hypermagnesemia. Chronic hypertension definitely is a risk factor, major one for heart failure. A nurse notes painful sputum in a heart failure patient. What does this indicate? A. Worsening right-sided heart failure. Sputum is a sign of B. Pulmonary edema, the lungs. That is C. Edema, congestion in the lungs. So the answer is mild dehydration. 17. So, which instruction should be included in discharge teaching for a patient with heart failure? Discharge teaching for a patient with heart failure. A. Weigh yourself weekly and report a gain of 10 pounds. B. Take your diuretic before bedtime. C. Report difficulty breathing or sudden swelling immediately. And then D. Increase your fluid intake to prevent dehydration. So the answer is report difficulty breathing or sudden swelling immediately. Sudden swelling is a sign of exacerbation of the heart failure. Okay. Weigh yourself weekly. We don't teach them to weigh weekly, we teach them to weigh daily. And then take your diuretic before time, is preferably in the morning because patient is going to wee or pee at night. And then increase your fluid intake. We wouldn't encourage people with heart failure to increase fluid intake. Question 18. A patient on digoxin has a heart rate of 48 beats per minute. What is the nurse's best action? You shouldn't give digoxin when the heart rate is less than 60. So what will you do? A. Administer the dose. B. Hold the dose and notify the provider. C. Double the dose. D. Encourage exercise. So the answer is B. Hold the dose and notify the provider. Question 19. Which finding in a patient with heart failure indicates effective treatment? You are treating heart failure. Which finding indicates effective treatment? A. Weight gain of 2 stones in 24 hours. When you are treating heart failure, we want them to even lose weight. Okay. So weight gain wouldn't be an option. B. Decreased edema and improved exercise tolerance. C. Increased BNP level. D. Persistent autopnea. So the answer is what? B. So we want heart failure, we want BNP level to rather decrease, and we don't want autopnea or difficulty breathing while lying. We don't want them. So what we want is B. And the very last question, which is the priority goal for a patient with heart failure? A. Maintain high sodium diet. It will cause fluid accumulation. We don't want it. B. Increase cardiac workload. C. Prevent fluid overload. And then D. Promote fluid retention. So which is priority goal for the patient heart failure? Choose an answer for this one. Maintain high sodium. Is that the priority goal? Increase cardiac workload. Prevent fluid overload. Promote fluid retention. The answer is prevent fluid overload. How many questions did you get right? And have you seen that reviewing the content of heart failure is helpful here? Understanding the left and the right-sided heart failures will help you. Nursing management for patients with heart failures will help you to have that knowledge in your head to be able to work these questions out. Watch my previous video if you've not had a review of the full content of the heart failure. I'll come to your way again with another exciting episode. Thanks for watching. If you like this video, kindly subscribe and like for me and share to your colleagues. Thank you very much. See you again. Bye.